For this exercise, you should lay down on a flat and firm substrate, like the woman on the picture. Make the substrate soft by a towel or a yoga mattress, and you can, if you want, take an extra support for your head. And lay down, like I said, as the women on the picture, with your legs a little apart, with your arms a bit wide from your body, and put your arms and your hands in a neutral position. Maybe you like it with the palms face up, or with your hands in a middle position. And your fingers are flexed a little bit. You should be able to be in this position for 30 minutes. Make sure there's no pressure from the bladder. Go to the bathroom if necessary. And make sure temperature is comfortable. You must feel comfortable enough and to be able to relax as much as possible. The aim of this exercise is to release as much of the body muscle tension as possible, to let it go bit by bit. And muscle tension is connected to your alertness. The alertness of the mind always has direct influence on your muscle tension. In a lot of situations this is good, but for now we want to let go of the muscle tension and let go of all the alertness. So this is a training also in letting go, alertness, being alert on things in the past, things in the present, and things in the future. Just try to let it go. And with this exercise, I will help you. You can see this exercise as being a training program. You don't have to do this exercise all the way. You can try it for 10 minutes, 15 minutes, and then quit. And try it again from start and go a little further. And I will remind you of the possibility to quit the exercise regularly. Now feel the substrate, feel the floor or the mattress where you are lying. Feel the contact your body makes with the floor, the mattress, the towel. Feel the pressure under your head, under your shoulders. Feel the contact between the arms and the substrate, and the back. Feel the firm contact between your bottom and the floor. Feel the contact of the legs, the left leg, the right leg, and feel the contact of the heels with the substrate. Maybe it's comfortable, maybe it's not comfortable yet, maybe it will never be comfortable. This is of not much importance. It's only for 30 minutes or so. Being aware of feelings in the present, here and now, may be disturbed by thoughts and feelings. You may have emotions coming up. Maybe you can even expect this when you let go of everything, of all the alertness which is in your body, then sometimes emotions pop up. And maybe it's good. But maybe it's too intense to go on with the exercise. Well, could be a moment to quit. That's no problem. And you can start tomorrow again with this exercise and see if you can go further. Same if you are getting too involved in your thoughts. Feel if there's any tension, any expression in your face. Because the face is a surface where emotions show. And for now, try to make your face neutral as much as possible for now. Feel there is no pressure on your lips and that your eyes are closed but not too firm. And we start with the release of the muscle tension with your feet. So bring your attention to your feet. Feel the position of both of your feet, your left foot, your right foot. Feel that they are rotated a little bit to the outside. And try to let go. If there's any tension left, try to let go. Try to relax your toes and your feet as a whole. And together with your feet, you can let go of all the tension in your calf muscles. The muscles in your lower leg are connected with your feet. So let go as much as possible of all the tension. Don't move them, just let go. Release the tension in your lower legs. So your calves become soft. And your feet maybe turn a little bit more outwards. And your toes start to point more down. If not, it's okay. Focus on your lower legs being released of all tension. And see the thoughts you have as passers-by. Of course, there will be thoughts. Of course, there will be distractions. Let them pass by for now. Try also to release yourself of any thoughts connected with the past, the present, or the future. And go back with your attention to your lower legs, to your knees, And try to soften your knees. And you soften your knees by letting go all the tension in your upper leg. So let go of all the tension in your upper legs. Let it go. Release yourself of all the tension in the legs, both of your legs. Maybe you can feel difference between left and right. Then focus on the leg where you feel there is some tension left. Then, next step is going to your gluteal muscles, your bottom. You can feel the pressure on the floor. And by letting go more tension in your bottom, it will be more flat and there will be more pressure. Try to release yourself of all the tension in your gluteal muscles. So that your whole lower body is as relaxed as possible. And try to keep your attention to this part of your body and let go of all the passers-by which are not important right now. And if you don't succeed now to let go all these passers-by, if you get too distracted by emotions or by thoughts, then it's okay to stop and go on a next time, but start from the beginning. If you want to go on now, we start focusing on the trunk, this big body part, which is, if you pay attention to it, is dominated by your breathing. The only movement in your body right now is the breathing. And you can feel the breathing throughout your whole trunk. The breathing goes on. And first I want you to pay attention at the bottom of your trunk, which is the bottom of your pelvic floor. Here we have the pelvic floor muscles. And try to let go all the feelings of shame or whatever. The pelvic floors are there for you. They are important. And if you focus on the pelvic floor, you can feel they're moving together with breathing. Feel the breathing coming in and going out of your pelvic floor. And by letting go, by releasing yourself of tension in these muscles, the movement will increase a little bit. Feel the movement of the breathing into your pelvic floor, in and out. breathing goes on, and let your attention flow to your abdomen. You have this huge abdominal wall, which are different layers of abdominal muscles. Feel the movement of the belly with the breathing. And also here, try to release you of tension. It's a difficult part to let go of the tension. Take your time. Feel the movement of the breathing and feel that it will increase a little just by letting go the tension. Don't judge your breathing, just feel and feel it now in particular in your abdomen. Feel the movement of your belly. And feel the movement of the belly on top and at the front, and feel it on the sides, both sides. It's a big area which is soft and flexible. And you're now busy training yourself to let it become more flexible. And again, if you get distracted too much, or if you're, for some reason not able to breathe, focus on your breathing, then you can quit for now and try it again some other moment. By doing it more often, you will get more familiar with your body, and you will be able to focus better and better anytime you do this exercise by starting it from start. If you want to go on, then focus on your back, your lower back. Focus on the part of the back which is between your pelvis and your ribs, your chest. There is a part of your lower back which is sensitive with a lot of people. And if it's sensitive with you, then don't focus on the pain, don't focus on the tension, but on letting go of the tension. By feeling the movement of breathing also in your back. Feel the tension and try to release the tension. Try to let it go. And use the movement of breathing for letting it go. Try to let go of all the tension in the lower part of your trunk as good as it gets. It doesn't have to be perfect. This is a training. This is not a one-time exercise. We have reached the chest and ribs, and also the chest, the ribs are moving with breathing. It should not be only the belly, the lower part of the trunk. You can also, and you should also, feel the movement of the body in your chest. You can feel it in the front, and you can feel it on both sides. Feel the sternum coming up, and feel the ribs going outwards. And let them go. Try to release yourself of all tension in your chest. Your chest can be broad and flexible. And by this movement of going out, going up, there will be more space for your heart. And blood pressure may drop. Let go all the tension in your chest, just by letting the breath coming in and going out. And by this time, maybe you still have some distractions, some thoughts, some feelings, maybe not pleasant, but if you have come so far, maybe you are able to accept that there are unpleasant thoughts and unpleasant feelings. And maybe you're also able to let them go now for this moment. Let them dissolve in air. And just focus on this nice and pleasant feeling of letting go the tension and the breathing in your chest. And follow your ribs to your back. On the back side of the upper body, you have the ribs. It's a firm part of your body. And it presses firmly to the floor. Feel that the pressure on the floor changes with breathing. Focus on the upper part of your back and let go of all the tension. Release yourself of any tension, muscle tension, and feel the breath coming in and out of your chest at your backside. And we travel on, and we are reaching the muscles between your shoulders and your head. The shoulder muscles. And a lot of people have tension in their shoulder muscles. Focus on this part of your body. Focus on the part between the shoulders, the upper part of your trunk and your head. So this includes all the muscles going through your neck. And try to let go of all the tension in your shoulders. And maybe you can feel your shoulders coming down a little bit, together with this relaxation. Let go of all the tension in your shoulders. Maybe for you it's more easy to let go of this tension in your shoulders with the out breath. Keep it still when you breathe in and try to let go of more tension when you breathe out. And let go of tension you have in your neck, which for a great part are the same muscles. And when you let go of more tension in your neck, your head will be more heavy. It becomes more heavy. And maybe you can feel your chin coming inwards. Try to release your chin of all unnecessary tension. Just let it go. Release all the tension of your shoulder up until your head. And your chin, your neck. We travel on and we have reached the face again, but we are going to try to release your face of more tension. Feel the cheeks, focus on the cheeks, and try to let go of all tension still there. And by letting go tension in your face, your cheeks, your facial expression will be more neutral. Like nothing is important right now. Which is true. And try to let go all the tension around your nose. So your nose will be more broad. So more air can go in and out of your nose. And it's okay, if it feels okay, to open your lips, open your mouth a little bit. And feel there's no contact anymore between your teeth. So let go of the tension if you're in your cheeks, around your nose, and around your eyes. Your eyes are closed, but they are not firmly closed. Feel your eyes being light. Feel your face is neutral and comfortable. then go even higher to your forehead. And feel the tension going out of your forehead. So it becomes neutral, or like a newborn baby wandering, accepting everything, being curious about everything around you, without any judging, without being concerned about things in the past and things in the future. And now feel your total face is neutral and expressionless. And feel that it's good. And feel that you are one with your body. And that your body is free of tension, of or as much as possible. Again, this is a training. You should repeat this exercise to learn yourself, to learn your body. It's okay. It's okay to let go. To be fresh and not alert. So for a few minutes, focus on the body from toes to top. And wherever you think is necessary, let go of the tension. And you maybe may end in the center of your body, where you have your abdomen and your pelvic floor floating with your breathing. And now take your time to get up and to maybe stretch a little bit. Or if you do this before you go to sleep, good night.